All right, folks, let's take a look at some of the body regions. All right, now this might look a little overwhelming at first glance, but I think you'll realize that some of these words you've either heard of before or they make sense. Some of them might be brand new words. So when you come across something like this, you kind of go through and see which ones you know, and then maybe which ones you need to work on a little bit. I haven't mentioned yet, but note cards, that would be, another thing I would highly recommend. I do have Quizlets for each chapter, but you learn best when you're the one doing the work. All right, I came up with all the Quizlets. I did all the work for you. So a lot of times a student will realize that if they would just write their own note cards, you do most of the learning while you make the note card. So again, it might not be something you're going to immediately want to do, but if you find yourself struggling, that's one thing I'm going to recommend. Make note cards. The beauty of having note cards from A&P1 and A&P2 is you'll have them. When you move on to a medical program, whether it's nursing, whether it's physical therapy, whether it's occupational therapy, whether it's dentistry, or maybe your goal is to become a doctor or a PA, a physician's assistant. They're going to assume you know all this stuff. They're going to assume if you passed A&P 1 and 2, and you probably passed with an A or B because you wouldn't get into those programs with a C, they're going to assume you know everything. Now, are you going to know everything? No, you're going to forget stuff. But if you have note cards, you can pull out the note cards. One situation, for example, is hormones. Hormones give students a lot of trouble. There's a lot of hormones. There's a lot of things to know about hormones, but they're super important to understand if you're going into medicine. So if you have a stack of note cards, when you've learned all your hormones, you can refer back to those note cards. So again, it's probably not something you're going to want to do right away, but if you're struggling and you're serious about this, go buy some note cards and start making them yourself. If you're not willing to do that, again, I've got my Quizlets. Oh boy. Oh boy. Sorry about that. Occasionally you might hear some dog barking or a wife yelling at me or something like that. But I usually like to leave those in because it makes me, feel, or makes me seem a little more normal if I, have dogs and wife in the background. So sorry about that. Okay, so again, go through something like this and just see which ones you know, which ones you don't. But there are some that are more important than others. So I've kind of highlighted the ones, frontal, pretty easy. Frontal region is your forehead. Well, why might that be important one day? We're going to learn the bone right here is called the frontal bone. There's a lobe of your brain called the frontal lobe. All right, so that word is used a few times this semester. You'll notice orbital, eye, nasal, nose, oral, mouth. All things you've probably heard of. Cervical means neck, so that's going to become important when we learn about the vertebrae that are in your neck. We call those cervical vertebrae. There's 7 of those in your neck. We also use the word thoracic for the vertebrae that are in your chest. And then we use lumbar for the vertebrae in your lower back. So those words are used quite a bit when we get to bones, for example. Sternal is your breastbone because the sternum is your breastbone. So some of these regions are named after bones. Some of them are named after, other components. Inguinal. Inguinal is a good one because you may or may not have heard that one. But the inguinal region is your groin. All right. There's, an inguinal canal there. You could get an inguinal hernia. There's inguinal lymph nodes in that region. So that word inguinal is a pretty important one. Let's see. Buccal means cheek. There's a buccinator muscle in there, but buccal means cheek. We're going to use that a couple times. Mental means chin. We're not going to use that word a whole lot. There actually is a mental foramen in there. Foramen means hole, so in that mandible. So again, some words we use quite a bit, some you might not ever hear. Clavicular is named after the clavicle. So the clavicle is your collarbone. So this is the clavicular region. Axillary is an important one. Axillary means armpit. All right. So there's an artery in there we call the axillary artery. There's a nerve called the axillary nerve. So a lot of structures, a lot of blood vessels, nerves, and whatnot are often named after the region. Brachial is important. Your brachium is your upper arm. So it goes from shoulder to elbow. That area there is your brachium. So that region is called the brachial region. There's an artery in there, the brachial artery. That's the one we often use to determine blood pressure. Your forearm is the antebrachium or antebrachial region. Carpal is your wrist. We learned about carpals before. So carpal is just this region, the wrist. So then we name the bones the carpal bones. Coxal means hip. We'll learn that word when we get to your bones, the hip bones. Femoral refers to the thigh because there's a femur in there. So we call that region femoral. Got a femoral artery in there. There's a femoral nerve. Patellar is kneecap. So this would be the patellar region. Behind the knee is popliteal. Popliteal is the region behind the knee. So again, I just mentioned the ones that I know we're going to get to pretty soon. So, I wouldn't worry about learning all these words just yet. We'll get to them eventually. But the ones with stars, I would go through and just, if you know it, great. If you don't, maybe, make a note card. All right, next thing are the planes. So again, a plane is either an imaginary line or it could be an image. Maybe we're using an image instrument to take a picture through a plane. Or if we're dissecting, we could do planes. But planes are used to visualize internal structures. Sagittal planes are vertical and they divide the structure, whether it's a whole organism or an organ, into a right and left section. All right? But there's a couple different ways to do that vertical plane. If it's right down the midline, right down the middle of in this case, a whole organism, or maybe it's right down the middle of a bladder, it would be mid-sagittal. All right? So mid-sagittal planes, often called median planes, we're going to divide that organism or structure into equal right and left. If it's off to the side, all right, notice this sagittal plane is not down the midline, it's off to the side. It's going to divide it into unequal sections. All right, you might want to do that if you're going to look at a kidney. Right, kidneys don't lie along the midline; they're off to the sides. So you can't do a mid-sagittal plane and look at a kidney. You got to do a parasagittal plane. So again, sagittal planes are vertical, and they divide the structure into right and left. Next way we could divide an organ or organism is by frontal or coronal planes. These are also vertical, but you don't divide into right and left. You divide into an anterior or a front section and then a posterior section. So you'll notice this little pink plane, if you will. It's kind of hard to conceptualize, but it's dividing vertically into an anterior and posterior. And then we have transverse. Transverse is horizontal. So we can do a transverse plane. We can look down or up at that section or whatnot. All right, so a transverse plane is horizontal. We're dividing into a superior section, so that would be this section here, and then an inferior section. Then this drawing shows an oblique. We don't use that word all that much when it comes to planes, but we will use that word. It means on an angle. For example, you've probably heard about you have oblique muscles in your abdomen. They run on angles. So those are planes. Why are they important to know? Looking at internal structures. So notice here we have, a couple drawings to help you understand, and then this is an actual, brain that we're looking at 3 different ways. So this would be mid-sagittal. All right, we're dividing that brain right down the middle. All right, so now we can better visualize these structures here. There would be a mid-sagittal plane through an actual brain. Coronal, again, vertical, but we're dividing into an anterior and posterior section. Notice the brain looks totally different, right? Because we're looking at a totally different plane. And then transverse, again, horizontal, and we can look at that brain a little differently. So imaging programs do this, so you can go get an MRI or a CAT scan, and you can look at structures, all different ways. So make sure you know your planes. All right, next thing, body cavities. Most of the images are from your book, the McGraw-Hill book. Occasionally, if I like the image from a different book, I'll keep it, and use it again. I'm not really supposed to, but I like this image from, a different book because it kind of divides, it gives you this table of cavities and then what's inside the cavity. All right, so let's go through your body cavities. First thing we do is we learn the 2 large cavities. The dorsal cavity is shaded in green here. So remember, dorsal means towards the back. So this is a cavity towards the back of the body. And then kind of purple and reddish, that's all a cavity towards the front. So that entire thing is called the ventral cavity. So those are the 2 big cavities. Now, cavities are often then compartmentalized. All right, so the dorsal body cavity is divided into a cranial cavity and then a vertebral canal or vertebral cavity. All right, so for example, your brain is located in the dorsal cavity, but more specifically, it's in the cranial cavity. Your spinal cord is located in the dorsal cavity, but more specifically, it's in the vertebral canal. All right, so that's the dorsal cavity. The ventral cavity has a lot of compartments. All right, so we take the ventral cavity and we first can divide it using the diaphragm. So your diaphragm is going to separate that dorsal cavity into a thoracic cavity superior to it and an abdominal pelvic cavity inferior to that diaphragm. Then we can take the thoracic cavity and we can divide it up. We can divide it into pleural cavities. Those are for your lungs. So that might be a new word. Pleural or pleura refers to lungs. So you got a pleural cavity here for your left lung. You got a pleural cavity here for your right lung. In between the pleural cavities, this whole area here is called the mediastinum. And that's usually a new word for A&P students. The mediastinum is the central portion of the thoracic cavity in between the lungs. It basically extends, behind or posterior to your sternum. It's anterior to your vertebral column. The uppermost part of it is basically at your first rib, and the bottom of it is at your diaphragm. So this whole area is the mediastinum. Then, within the mediastinum, there's a cavity just for your heart, and that's called the pericardial cavity. So we often like to take, areas and divide them up into smaller areas. That allows us to be much more precise or more specific. So if someone asks you, where is my lung? You could say, it's in the thoracic cavity. But a more precise answer would be it's in the pleural cavity. All right? Okay, so that's the thoracic cavity. Again, it kind of describes, what those are and what organs are inside those cavities. Below the diaphragm is the abdominal pelvic cavity, but then we can subdivide that into the abdominal and then the pelvic. Now, there isn't a defined structure, all right? It's kind of arbitrary. So basically, someone just said, hey, let's draw an imaginary line separating these. All right, there isn't like a diaphragm separation. All right, so the abdominal pelvic cavity is divided into the abdominal cavity. There's a whole bunch of organs in there. And then the pelvic cavity, which is going to contain your bladder, some parts of your large intestines, and your internal organs of reproduction. For example, ovaries, uterus in a female. It's going to have prostate gland, some other glands in males. So a lot of subcompartments. All right, so use this drawing to help you understand, and then down here is kind of helping you divide up that thoracic cavity. All right. The abdominal pelvic cavity, because it's so big and so many organs, they then divide it up. And there's two ways you can do it. You can do it with 4 quadrants. So basically an imaginary line down the midline, horizontal line about where your belly button is located. And then you've got the 4 quadrants. Upper 2 quadrants, so your right upper, left upper, right lower, and left lower. Now notice some of these organs take up more than 1 quadrant. So if you're asked, what quadrant or quadrants is your small intestine, you'd say all 4. All right, there are parts of your small intestines in all 4 of these. If you're asked where the appendix is located, there's the appendix in this drawing. It's in the right lower quadrant. Where is your gallbladder? Right upper quadrant. Where's your spleen? It's not shown here, but it's in the left upper quadrant. Where's your stomach? Well, most of it is in the left upper quadrant. Little bit of it is over here in the right upper. Where's your liver? Most of it's in the right upper quadrant. Little bit of it in the left upper quadrant. Where's your urinary bladder? Well, half of it is in the right lower and half of it is in the left lower. I like quadrants. You'll be asked about quadrants. I typically don't ask much about regions. Doesn't mean that, if you move on to a medical field, they're going to expect you to know, but you can probably get up to speed pretty quickly. When we do abdominal pelvic regions, it's 9. So it's basically like a tic-tac-toe grid. And these 9 regions have names. So for example, epigastric is this region. Basically, epigastric means above the stomach. It's above the stomach. Some of the stomach is in that region. Umbilical region, that's right here, kind of the middle region. And then hypogastric means below the stomach. Yeah, it's way down here. So that's where your bladder would be. You've got iliac regions, also known as inguinal regions. So this is kind of the groin areas here, or just above the groin, really. So you got right and left iliacs. You got lumbars, which mean lower back, right and left lumbars. And then you have hypochondriac regions. Now that's kind of confusing because that word has a couple meanings. Some people have heard that word in the context of, some people think they're sick when they actually aren't. Well, that's a hypochondriac. This is a different meaning. Hypo means below. Chondriac means cartilage. So your ribs have cartilage, and this region is behind there. So again, we're not going to use these terms very often, but that's these upper areas here, hypochondriac. Chondriac means cartilage. So focus on the quadrants. So if you're asked, what quadrant is the spleen, you should be able to answer left upper and so on. All right, last topic of chapter 1 are serous membranes. Now, serous membranes are flat tissues. A membrane is typically a flat tissue that surrounds an organ. These serous membranes are double membranes. So there's actually 2 layers to the membrane. And then in between the membrane, there's fluid. All right. And there's 3 of these. And we typically cover these in A&P2 because they involve the heart, which we learn about in A&P2, the lungs, which we learn about in A&P2, and the abdomen, which most of those organs we learn in A&P2. So we're going to get to these in A&P2, but you should be aware of these membranes. So there's 2 layers. The outer layer to the membrane is called the parietal layer. Parietal means wall. So it's basically adhering to the wall of the cavity. All right, so here's the parietal pericardium. It's this outer layer that's adhering to the wall. Here's the parietal pleura. It's the outer layer adhering to the wall of the chest. And then there's a parietal peritoneum on the wall. All right, so the outer layer is called the parietal layer. The inner layer is called the visceral layer. Now, visceral means internal organ. So viscera, right, would be the heart. It's an internal organ. Lungs. All these intestines are called viscera. So that's the layer, the inner layer that's actually attached to the internal organ is the visceral layer. And then again, there's going to be fluid in between. So like surrounding the heart, there's pericardial fluid to help lubricate that heart. There's pleural fluid surrounding the lungs. And then there's pericardial fluid. Or I'm sorry, peritoneal fluid. So the three serous membranes all kind of, again, have the same format, if you will. There's a parietal layer, there's fluid, and then there's a visceral layer. And the three serous membranes are named pericardium, because it surrounds the heart, pleura, which surrounds the two lungs, and then the peritoneum, which is in the abdomen. And that one's really complicated because it actually also kind of attaches organs. So notice these are all like cross sections of the small intestine, and this part of the peritoneum is kind of holding all those intestines in place. So when we get to the digestive system, we'll learn more about this peritoneum. All right, so that ends chapter 1. So again, have your checklist. Hopefully, you can go through that checklist and, start learning topic by topic. Do Quizlet in the module. You should be able to find a Quizlet that goes over a lot of this stuff. There's probably an ID game or two. So I've also made ID games. Whenever there's something you have to learn how to identify, you'll find the ID games in the module. Make your own note cards. Rewrite notes. Hopefully at this point you should be looking down and you have notes somewhere. All right. If you haven't taken notes, we'll see how it goes. All right. And again, everyone's different. Some students can go through these lectures, not write anything down, and be perfectly fine. Some students struggle. And if you're one that's going to struggle, I recommend taking these lectures more seriously and take notes. All right. But for the most part, I recommend, studying, do whatever you think is going to work, and we'll see how it goes. You won't really know how it goes until exam 1. Exam 1 is when you find out whether whatever you've been doing works or not. All right. Quizzes, you'll notice online quizzes, you can use notes. So the quizzes, you'll probably look at notes, or you'll look at your study guide, or you can even look up answers if you want. But exam, you can't do that. Exam, you cannot use notes. You cannot look up answers. You need to use your brain. So exam 1 is going to tell you whether all this work you've been doing works for you. All right. If you do poorly on that first exam, it's not the end of the world, but whatever you did didn't work. So you need to make changes. All right. Always communicate with me. So reach out to me, email me in Canvas inbox if you're having trouble, if there's any problems. But again, these lectures are the #1 resource for you to study. So at this point, you should start studying, all right, while this stuff is fresh in your mind.